Hello everybody, this is Dr. Nadeem and we are with Neelam Path Lectures, the Pursue series. As you are aware, all our lectures are available on YouTube. You can download them. You can go and subscribe them as well. We have a Telegram group which is very good for accessing all lecture related information. Please join the group. We have a Google Drive where the PDF of most of the lectures are available. These are the disclaimers. We are with phase 3, which is recorded pathology lectures. And today we have Pursue 3I, which is soft tissue and bone tumors. And we are streaming live from Kolkata. And to talk on this, the topic of the day, which is bone pathology session 1, understanding the basics. We have the famous Dr. Bhaskar Mitra. He is an MBBS from Calcutta, MD, DNB pathology, gold medalist. He is a consultant histopathologist at the famous doctors Tribedi and Roy Diagnostic Laboratories, Kolkata, with multiple publications in national and international journals. With this, I would request Dr. Bhaskar Mitra sir, please start your lecture on bone pathology, which is the basic part, session 1, which will be dealing in trying to understand the fundamental concepts of bone, its histology, and various terminologies in relation to bone pathology. So over to Dr. Bhaskar Mitra sir, please start your lecture. Thank you so much.
Good morning, everybody. I am Dr. Bhaskar Mitra. Today I will be discussing about the bone pathology. To understand the bone pathology, we have to know our mother tissue, the bone first. What is the bone and what it is composed of? Initially, the bone pathology actually looks like this. We have to approach the bone pathology in a systematic way so that a proper diagnosis can be reached with a systemic procedure and there would be no gap in between. Now, something about the basics of the bone. What is bone made of? Histologically, what it is? I mean, what is compact bone? What is trabecular bone? How the bone is made of, what are its cell composition, and what is its matrix. Now, how the bone is formed by the process of intermembranous or by the process of endochondral ossification. Then the final part, the remodeling of the bone, which constitutes the reorganization and restoration of the. Now, this is the basic anatomy of the bone. Here we can see in the center part of the bone there is a marrow cavity and these are the two ends of the bone. So this is the diaphysis and these two are the epiphysis of the bone. Now there is a part of bone which is very solid, thick and stout. This is the compact bone, and in the end of the bone we see the bones in a spongy pattern. This is called the cancellous bone or the spongy bone. Now, when we cut longitudinally a long bone, it actually looked like this. This is the stout and compact part of the bone. This is called the compact bone. This is a dense layer of the bone which mainly forms the outside part of the bone. And this is the spongy part or the cancellous part where we can see like an honeycomb appearance the bony trabeculae, and in between there is a sheep-like appearance in which the marrow cells are there. Now, regarding the classification or type of the bone can be divided into the different types. First is the long bone, where the one of the dimension is much high, like humerus, femur. Short bones has almost nearly equal breadth length in all the aspects, like the carpal bones, tarsal bones. The most important part, flat bone. The anatomy I discussed previously was of long bone where there is a medullary cavity. In the flat bone there are two areas, that is the compact bone on the either side of the bone and in between there is a spongy cancellous bones. Then comes the irregular bones. From the shape, the vertebra, the hip bones, the ethmoid bones, these are the irregular bones. Now coming to the general histological constitution of the bone, I will go from outside to inside. In the outside there is a layer called periosteum which is covering the bone. It is the outermost part of that consists of fibrous sheath. It is of dense regular connective tissue overlying the bone surface. Inner part of this is constituted by the inner cellular layer. These cells are osteoprogenic cells. This may give rise to bone and the covering material. So these are the osteoprogenic cells. These are more well defined and more developed in the progressive or growing stage of. Now, if we peel the periosteum from the bone, we can see small sharp fibers that passing through the periosteum and incorporated within the bone. These are the collagen fibers arising from the ligaments and the tendons which are extended directly into the bone collagen fibers, and these are called the sharpest fiber. This is how the bones, the tendons, the muscles it inserted into the periosteum. Now coming to the bone cavities. There are two types of bony cavities. One is on the central part or the diaphysis. This is a long, widely open bone cavity which contains the yellow marrow. The name yellow suggests it consists of mostly fat cells. Along with there are the marrow materials. In the cancellous part, the spongy sheave-like areas, it contains the red bone marrow material. But it is interchangeable. Yellow marrows, as per requirement, when there is excessive blood loss or more production required for the homeopoietic system, the yellow bone marrow transforms into red. Then after the periosteum bone cavities lies the endosteum. It is the inner cell layer, thick cell layer of the bone. This is mainly present surrounding the marrow cavities, like the fatty marrow cavity, the inner layer of the fatty marrow cavity, and it surrounds the individual trabeculae. If we take the sheave and see a greater picture, here the individual trabeculae is covered by the endosteal layer. In between there is a bony lamella. Now, the another important part of the bone is its blood supply. When grossly we see a bone, we can see multiple foramens on its surface. These are nothing but the nutrient foramen through which nutrient artery and vein goes inside, and it traverses through the medullary cavity and supply the bone from the inner side. Another blood supply is from the periosteal artery. So the periosteal artery and the nutrient artery supplies the bone, among which nutrient artery mainly supplies the diaphysis part and the epiphyseal plate or the growth plate. The nerve fibers passes along with the blood vessels. The periosteum is one of the area where it is densely innervated, so it is. Now, regarding the structure of bone, I may take two sections. One section from this area where we can see both the compact and the cancellous bone. So there is the presence of this compact bone, the dense bone area, and there lies the trabecular bone in between the marrow cavities. There are the red blood cells. These are inside, it is covered by endosteum. On the periphery, it is on the outer aspect, it is covered by the periosteum layer. Now, if I take a section from this part, that is the diaphysis part, it would look like this. It is covered on the outer surface by the periosteum. The nutrient artery goes inside through this nutrient foramens, and inside there is a fatty marrow material, and the inner side of the bone is covered by the endosteal layer. So this is the orientation of the compact bone, and this cancellous bone we also call them as a trabecular bone. So it is interchangeably used, trabecular bone, cancellous bone or spongy bones. These are mainly the end of long. Now, histologically, how the bone is formed. It is mainly formed by individual unit of bone that is called the osteon. Here we are showing you the osteon. What is osteon? There are lamellar arrangement of the different collagen fibers in different direction which gives this lamellated appearance of the bone, and in between there is a nutrient blood vessels on the center part of the system. This is called Haversian canal or Haversian area through which the blood vessels and nerve supply goes in. This is the cut section of a trabecular bone showing the similar lamellar pattern. Now, in between the lamellae, there are small spaces. This is called lacunae. Lacunae means gap. In this lacunae, we will discuss more in details of this. So, now how the compact bone looks like. So, it is compact bones look like this is the single osteon where there is a lamellar bone. So this is the single osteon showing the lamellar bones. In between there are white spots, or these are the lacunae. This is the central part of this system, that is the Haversian system or the Haversian canal through which blood vessels passes. This is the Haversian system. This is the lamellar bone. Now this is the trabeculae of bone. These are the trabeculae of bone. In between there are fat spaces. This trabeculae. So this is the compact bone where we can very clearly see the lamella of the bones, and these are the lacunae, and the lacunae contains a certain type of cells that is called the osteocytes. So this is how the compact bone looks like under the microscope, and the trabecular bone looks like under the microscope. So this is the mature bone composed of these cylindrical units. What I am talking about is called the osteon or the Haversian system. The osteon consists the concentric layers of the bone, lamella of bone matrix surrounding a central canal, and this central canal contains the vascular and nerve supply of the individual bone. Now, there are some spaces in between these lamellae. These are called lacunae, means gap, which contains the osteocytes. This osteocytes has got a numerous processes. Through these numerous processes, it communicates with the other osteocytes, and if there is some gaps in between, these are called canaliculi, through which the osteocytes get gap junction attachment to the other osteocytes. This helps to serve the passage of the substance between the osteocytes and the blood vessels. Now this is the single osteon. Here we can see collagen fiber and mineral salts aligned in a reverse in different direction in each of the lamellae, and each lamellae contains this lacunae. The lacunae which contains the osteocytes, through the processes of the osteocytes, it communicates with the other osteocytes. This is again, these are the different lamellae, and in between these there are some transverse. These are the Haversian canal or the Haversian system through which blood supply and nerve supply goes in, and there are some transversely oriented channels or canals. These are called the Volkmann's canal, through which the blood supply passes to one area to another area. So these are called Volkmann's canal or the perforating canals. The blood vessels and nerves travels from the periosteal to endosteal surface to reach the osteonal canal, or also through these perforating canals. So this is the final picture histology of a compact or the lamellar bone. Here we can see the Haversian system containing the blood vessels and the things. It is surrounded by lamellae of the bone in different direction, in which, between which there are small lacunae. In this lacunae there lies the osteocytes, which helps in the proper growth and maintenance of the bones. Now more about the spongy bone, or there lies the different trabeculae. Here also lies the lamellar attachment, the osteocytes. These are differently present here to give the supply to. So this is the trabecular part or spongy part containing the different osteons in this trabecula. Now, the color of the bone may differ as per the age of the bone. The first newly generated bone is called the woven bone. This is the woven bone. Here we can see, compared to these mature bones, the lamella are disorganized or less prominently made. The Haversian system was also not properly made in the initial woven bones. So these are the disorganized lamellae. Here it is more organized, Haversian system better delineated. In between there is a medium side area where the Haversian system is prominent, but still the lamella is not organized. And one thing you have to remember very carefully under the microscope regarding the identification of this woven bone, the woven bones, the matrix material is more of hematoxylin affinity, so it stains more of a violet, and here the mature bones is of more eosinophilic, so it has got affinity for the eosin, so it stains more pink. So it's the mature bones are more pink, the immature bones are more violet. This is the arrangement of the lamellar arrangement of a mature bone. This is the woven bone where the lamellar arrangement is lacking. As the lamellar arrangement gives strength to the bone, the woven bones are very weak and very prone to. This is the immature bone, the woven bone. It is the actually developing fetus. Comparison with the mature bone, they do not display the organized lamellated appearance. They contain randomly enriched, relatively more cells per unit area, and the ground substance is not heavily mineralized. Stains more intensely with hematoxylin, whereas the mature bone stains more intensely with the eosin. This is again the histological comparison, the adult lamellar bone and the woven bone. Now, when there is a disorganization of this mineralization and lamellar formation, they or defect in the collagen material that give rise to disorganized lamellae of arrangement. What we see in the Paget disease is this kind of pathology. So you can readily appreciate, once you understand the lamellated and the Haversian system arrangement, here you can clearly delineate that this organization of the bone is pathological, and definitely there is a disease process, and this is the disease called Paget's disease. Now regarding the bone matrix, it is mostly made up of the collagen fibers, 90% of it, and along with the ground substance like osteonectin, osteocalcin. There are mostly collagen type 1 fibers. The inorganic salts gives hardness to the matrix material. The calcification occurs in this bone matrix material, which may take few days to several months to properly develop. So these are the matrix. After, what are the cells? That is important. Now the cells I am talking about is a very important area in the bone. Here we can see different types of cells. First of all, the osteoprogenitor cells, osteoblast, osteocytes, bone lining cells. Another is the osteoclast. Now, among the whole bony matrix, the water is 25%, 25% is the protein material, and 50% are the mineral salts in a normal bone. Before going to individual details of the individual cells, I will like to show you this picture. This picture gives you a very clear-cut idea and function of the individual bone forming cells or cells present in the bone. First of all, the mesenchymal stem cells. It gives rise to these osteoprogenitor cells. What we first learned in the periosteum, the osteoprogenitor cells lies inside the inner part of this bone. Now, inner side of the periosteum. Now, these osteoprogenitor cells may differentiate into two types of cells. or rather to say three types of cells. One is osteoblast, which gradually ultimately give rise to this osteocyte. The osteoblasts are the bone forming cells. Osteocytes are also, but osteocytes more helps in the mineralization. Osteocytes are mainly seen within the lacunae in the bone. Now you understand what are the lacunae. Now osteoblast mainly lies beneath the periosteum layer, and now the periosteum, inner side of the periosteal, there are cells. These are called periosteal cells or the bone lining cells. Note importantly, osteoblast, osteocytes and the bone lining cells all develop from the osteoprogenital cells and its great grandfather from the mesenchymal stem cells. Now comes another group of cells that is called osteoclast, or in simple words we say these are the multinucleated osteoclast like giant cells. These osteoclast help in the bone resorption and the remodeling. Normally they lies in inactive form. They usually comes from the granulocyte monocyte progenitor. So the origin of the osteoclastic cells is not the mesenchymal stem cells. The origin is different. That's why the giant cell tumors and other things we have to see the other nomenclature and the origin of the cells. And again, I forget one thing, that is the inner side of the bone is also lined by endosteal cells, which is actually derivation from this osteoprogenitor cells. So two great grandfathers, that is the mesenchymal stem cells giving rise to osteoblast, osteocytes, bone lining cells, granulocyte monocytic progenitor which ultimately give rise to osteoclast. Individual description of the individual cells. This is the osteoprogenitor cells. It is derived from the mesenchymal stem cell. These are the resting cells that can differentiate into the osteoblast or can secrete the bone matrix. They are found on the external and internal surface of the bone. This is the normal locations of these osteoprogenitor cells. Morphologically, they comprise of the periosteal cells and forms the innermost layer of the periostea and endosteal layer, and it also surrounds the Haversian canals or the perforating canals or the Volkmann's canals. Now you are very familiar with this thing. What is called Haversian canal? What is called Volkmann's canal? This is the site for the osteoblast and the osteoprogenitor cells. Now osteoprogenitor cells differentiated into the more bone forming cells that secrete the bone matrix, type 1 collagen, etc. bone matrix proteins. These are the osteoblasts. The active osteoblasts are cuboidal to polygonal in shape and usually lies in aggregate or a single layer in just forming the apposition to the bone. So these are the locations of the osteoblast. The osteoblasts are just lies beneath the periosteal layer. Inactive osteoblasts are the flat. Attenuated cells are covered on the bone surface. Osteoblast processes communicates with the other osteoblasts and osteocytes by the gap junctions. Now comes the more mature cells of the bone. These are the osteocytes. They are mainly space occupied in the Lacqueline. Osteocyte processes communicate through the canaliculi with the other osteocytes, the bone lining cells, by gap junctions. They synthesize new matrix. They help in participate in matrix degradation and maintain the calcium homeostasis through the bone. Now comes the osteoclast. I purposefully kept it in a separate slide because the origin of the osteoclast is not from the osteoprogenitor cells. This is, as I said earlier, coliforming granulocyte monocyte cells are its progenitor cells. These are the multinucleated cells. They are bone resorbing cells. They present on the bone surface where the bone can be removed and remodeled. So a sculptor usually first made a thing of solid rock. Then gradually he chisel out all the excess bones or excess stones from this sculpture. Now the osteoclasts do this thing. They chisel out the unwanted bone material. So they do resorb the bone. So there is a space beneath the osteoclast. This is called resorption bay or Hauschip's Lacuni, through which the osteoclasts are present and do their bone remodeling work. Now coming after the cells, matrix and the general configuration of the bone, I am discussing more about the bone formation. There are two ways the bone can be formed in an embryo, that is a intramembranous ossification, another is a endochondral ossification. Now I first say the intramembranous, the name suggests membrane, so it suggests a flat thing. So intramembranous ossification is mainly for the flat bones of the skull, mandible, etc. So there are soft spots in the skull which helps in the remodeling of the child's skull during its birth. Next comes the endochondral ossification. These are initially formed from a cartilage or the cartilage model. It gradually ossifies into bone. So there is endochondral ossification. This is the intramembranous ossification. The intramembranous ossification starts in a mesenchymal layer. So there is a mesenchymal component different. In between there is a group of cells or the mesenchymal progenitor cells which starts forming this osteoblast. This osteoblast gradually secretes different type of bone matrix material within this fibrous membrane, and gradually this osteoblast matures into the osteocytes and forms the different trabeculae inside this area. So outer surface there are the osteoblast, inner surface there are mainly the osteocytes. This is how membranous way the intermembranous ossification occurs in cases of flat. Now this is the histological picture showing a flat bone with a center of ossification. This ossification center, there we can see different type of osteoblast, numerous number of osteoblasts are there. They are secreting the different matrix proteins. So here the bones are the woven bones. These are the newly formed bone. Lamella are not seen properly. The picture I have shown previously showing good lamella. Here we cannot see the lamella. These are irregular bones, and look at this in the surrounding. There is a mesenchymal scaffold or mesenchymal fibrous tissue through which the intermembranous way the ossification is going on. Comes the endochondral ossification. The name suggests endochondral. So there is a cartilage model or a cartilaginous scaffold through which the bone is formed. It is made up of cartilage. The center part of this area is called the enlarging chondrocytes are there. They gradually enlarges and they form the ossification, and the bone formation occurs here. So initially there starts in the diaphysis, the nutrient artery goes inside and there starts the ossification. So this is called primary ossification center. Gradually the calcification and ossification goes on towards the both ends of the bone, and with a overlying cartilaginous cap, or what I say, this is called the growth plate or the epiphyseal plate or the epiphyseal cartilage. Now on the top, the head end area, the nutrient artery goes and it another forms another center of the articular area. These are the secondary centers, ossification center. As a child progresses with the age, these ossification centers fuses, and this till these ossification centers are separate, that will help the bone to grow. Once they fuse, there is no growth plate, no cartilage, so the bone growth gets stopped. Picture of endochondral ossification. Here you can see the cartilaginous scaffold. The both end, these are the cartilage. Here the center part, the cartilaginous area has been modified and changed into the bone area. So and gradually the cartilaginous cap or the cartilaginous plate is growing towards this. This is called the growth plate or the epiphyseal plate. Now this is the cartilage. This is the growth plate showing endochondral ossification. So there is more hematoxylin stain on the bones, and this is the marrow material. This is the fatty marrow material in the center part of the medullary cavity or the growth plate or the epiphyseal plate. On the top of this, towards the end, this is the maturing cartilage or the chondrocytes, which are normally stays in a very resting phase. If required, it starts dividing. So this is called the zone of resting cartilage. Beneath it, the cartilaginous cells or the chondrocytes are proliferated much in number. So this is the zone of proliferation. Here the number of chondrocytes increases. Next comes the zone of hypertrophy. From our basic knowledge of general pathology, hypertrophy means increase in the size. So here the chondrocyte numbers are not increased, the size of the chondrocytes increases. Then comes the ossification or start beginning of this calcification. So as the calcification goes on, the mineralization goes on more properly, this area has turned into the bone. So it is growing, the bone is growing in this area. More areas, they are calcifying areas, they are approaching, so these are also moving upward. So here one thing to be remembered, the bone length is increasing, but the epiphyseal plate still it remains the same height and breadth as it starts. How the epiphyseal plate looks like under the microscope. This is the maturing or the resting phase of the chondrocytes. Beneath it, there is the proliferation zone of the chondrocytes. Here we can see the cellularity suddenly increases from this area to that area. So this is the zone of proliferation, followed by zone of hypertrophy. Here we can see more large lacunae of chondrocytes. So here you can see you barely can see individual chondrocyte, but here the chondrocyte size are much bigger. Then comes the calcification area or ossification area, followed by the ossification and bone formation and acquired by this bone marrow material. So that this red marrow is acquired through the different areas. Now again the growth plate, growing plate, this is the resting cartilage, the growing cartilage, hypertrophic cartilage, ossification zone, etc. Now regarding the growth of the bone, till now I am talking about how the bone length increases. Now what about the breadth or girth of the bone? The bone also resolves during this time as more and more ossification is going on the peripheral side. The center part of the bone is get resolved. So we get, after proper resorption, the compact bone outside with a periosteal covering on the outer aspect, followed by a compact bone. Then comes this medullary cavity, which is again insidely lined by the endosteal layer. So this is the medullary cavity, and here from the infant to adult, the bone regrowth and the resorption occurs inside the. Now regarding the reorganization and restoration, this occurs mainly during the period of growth and as it continues, because as the adult patient become more and more aged, this bone reorganization and resorption decreases. The wear and tear occurring in the bone is helpful for the resorption to do. Osteoclast and osteoblast both act side by side in reorganization and restoration. Osteoblast puts the bone matrix, osteoclast do the resorption act and remove the excess and unwanted things. New Haversian systems develops. Older Haversian systems shows interstitial lamella, capillary and nerve sprouts through this Haversian system and give the proper blood supply to the reorganized bone. Thank you to everybody. So just a short recapitulation. Today we learned how the bone looks like, what is its component, what is compact bone, what is spongy bone, where it is, where lies the marrow, that is the red marrow, and the concept of yellow marrow and its organization. Then the individual bone cells starting with osteoblast, osteoclast, everything and its how it forms and from where it comes, the ontogeny individually. Now next is how the bone grows, that is the ossification, intramembranous, endochondral, different type of ossification, how it looks like, and last but the most important thing, the identification of the woven bone, that is the identification of an immature bone from the mature bone and exact histological organization of a mature bone. So these are the basic things we have to learn first before going details into the bone pathology. On my next lecture, I will be discussing how systematically we can approach in the bone cases in which daily routinely comes to our table. So how we will approach? So on the basic of this basic knowledge of bone, we will next move on to my lecture on the approach to the bone pathology slides. Thank you everybody for listening the whole class.